I think we're all aware of the instances in recent months of unacceptable waiting times for ambulances and paramedics being directed, sometimes hundreds of kilometres, to respond to an emergency. This is obviously deeply distressing for families and communities who should be assured of access to emergency services. These fears are even more acute in rural areas where waiting times can be much more significant. The delays in the ambulance service are a cause of worry in themselves, but coupled with the erosion of health services in areas like Cork South West, communities are deeply troubled by the implications. Bantry Hospital is still awaiting the necessary investments to guarantee its future, while the closure of some services due to staffing in the summer demonstrated its precarity. Furthermore, the rationalisation of South Dock has resulted in reduced hours in Castletownbere and the closure of the Kinsale service. Combined, all of these issues greatly impact the rights of people in the area to access appropriate medical care. The focus on ambulance services is incredibly important. This is always part of a multifaceted and interlocking system. We need greater support for all these features together. In discussing this motion, it's important to note that we have incredibly dedicated and professional paramedics and ambulance service staff who are doing everything they can to respond to calls, and I think anyone that has interacted with them understands the commitment and skill they display in dealing with emergency and difficult situations. Emergency services are an essential public service. There should be no doubt or worry ambulances, in this case, or the fire brigade or Gardaí, will respond immediately to emergency situations. I think this has to be the bare minimum. It has to be a service that the state guarantees. Unfortunately, that's not the case. Instances highlighted in this House tonight, and I think in the media in recent time, reveal considerable waiting times, with several cases in Cork. The response time for both life-threatening call-outs and potentially life-threatening call-outs have decreased in recent years. But reports from within the National Ambulance Service show overstretched staff and inadequate resources, paramedics and other staff having their 12-hour shifts overrun, putting themselves and others at risk, and this is simply unacceptable. After a recent ambulance crash, the Southern Star reported on members of the ambulance crew beginning to speak out, saying that enforced overtime, which sees their 12-hour shift extended to 14, 16 and sometimes 18 hours, presents a real danger to them, patients' outcomes and long-term effectiveness of the service. There are 4 ambulances in West Cork, but they often travel massive distances to attend life-threatening calls in Cork City and Kerry on a daily basis, sometimes resulting in 1 or no ambulances being in West Cork. People have been in touch with me, and it was kind of amazing to hear the deputy saying it is obviously a very common occurrence that they've been waiting for more than 3 hours for an ambulance. And can you imagine if that was you? Or, you know, it's just, I can't believe how common it is. I thought it was an outlier down where I am. Paramedics reported having to apologise to patients for the length of time it takes them to get there, something that was described by one paramedic as embarrassing, saying worse than that, it's dangerous. And adding that, and I quote, "This has to be highlighted because people are going to die due to delays. We must have sufficient numbers of ambulances based around the country. We must have staff who work reasonable hours to be able to safely and effectively respond to emergencies. We must have a service that reaches all communities in a timely manner. The National Ambulance Service have identified issues leading to delays in responding to calls in different areas of the country, including increased arrival to overhand delays at emergency departments and infection prevention measures. Congested emergency departments can leave ambulances waiting at the hospital and tie up paramedics who should be out answering calls. It illustrates the complexity of the circumstances and the interconnection with other shortcomings in our health service. As we face into the winter season of increased numbers presenting in hospitals, especially through emergency departments, will this situation only get worse? Any efforts to address the delays in ambulance responses have to consider all the factors involved. The capacity review on the National Ambulance Service from 2015 highlighted the need for increased investment in vehicles and technology, the redeployment of ambulance stations around the country to better service communities, and hiring of additional staff. In cases where seconds can make all the difference, it's essential that the necessary investment is made in the service. For example, the improved locating of ambulance stations would decrease drive times and lead to an improvement in response times. Ambulance crews also believe the switch to operating the service from a regional to national basis isn't as effective as it might appear on paper, and I think that needs to be considered. The motion rightly calls for the urgent implementation of the review's recommendation. In addition, the capacity review calls for different clinical options as alternatives to converging all patients into already overcrowded emergency departments. In England, the development of alternative care pathways has allowed ambulance services to treat up to 50% of patients by other means other than transportation to A&E. However, this requires the creation of link-in services and availability of out-of-hour GP facilities, social services and emergency dental services. More specialist paramedic grades and development of community first responder schemes can also play a role here, not only in reducing the strain on ambulances in acute hospitals, but on providing emergency interventions and care at the point of need. The role of air ambulances in providing rapid emergency care, especially for island and coastal communities, it needs to be acknowledged this evening also. The air ambulance, I think, is underutilised and underfunded. Finally, ambulances are not just about emergencies. They're often key assets in transferring patients or people with additional needs for care in acute settings or even appointments. We need the capacity in the system to ensure these services are available to people. I've recently been dealing with a case where an older person in West Cork has regular appointments in Cork City, but is not guaranteed to make them due to the availability of vehicles. This is now a constant source of worry for their family, who are struggling to make alternative arrangements. It's simply unacceptable. We need a properly resourced ambulance service that guarantees the numbers of vehicles and supported staff to ensure the best possible response times. It is the least families and communities and the workers themselves deserve. It's also necessary to provide other services that assist and improve the function of ambulances, from fully resourced emergency departments and rural hospitals to out-of-hour GP cover and empowered paramedics. All of these features are connected. All of them necessitate proper investment and coordination, and this cannot happen fast enough. I'd like to thank Sinn Féin for bringing forward this motion, and I encourage all the deputies to support it. I know you said you wouldn't be blocking it, Minister, but I suppose the question is, when will you bring it in? Thank you.
People before